So I'm going to give you a 7-year-old kid. He's in a PICS emergency room. Of course, the mommy brought the kid because mommy noticed that, the mother noticed that there was a rash on the trunk, okay, and the legs for 3 days. And when the doctor looked at the rash, the mommy tried to describe it, but doctor described it better. He said it was a round rash. Okay, he has pink color in the center. But when you look at the surrounding, you saw raised erythematous border. Does it ring a bell? It's all buzzword. So when the NCLEX present it to you like that, don't be surprised. Like same thing, rash on the trunk and the legs for 3 days. Then this is what the rash looked like. Any clue yet? No, no clue. Then the mother said, well, the kid has Arthralgia. What does that mean? It means like painful joints, you know. So that's what they saw, painful joints. So the nurse quickly tried to get vitals, to get some vitals, and realized that the kid has a temperature of 101.5 and a heart rate of 90. Systolic blood pressure is like 100. SARS is fine, it's like 99%. And so, yeah, the mommy said he had some fever intermittently at home. So that's the story the mommy present. But the doctor was suspicious. So he said, let's order some labs while we examine, just draw some labs. And quickly the lab came back and you have elevated ESR CRP. So we have SED rate elevated and CRPs are also C-reactive protein also elevated. Any clue? 7-year-old, rash on the body, fever, joint, and elevated ESR. Something should be ringing in your ear. If you can, the doctor said, well, nurse, get some EKG. What I'm doing is I'm giving you all the things they can ask you if they give you 6-case study, all the things they can present to you to complete the study. You get the EKG, and what did you see? You saw a prolonged PR interval. And then on ST elevation, you see a diffused ST elevation. In all leads. So a 7-year-old with a diffuse ST elevation in all leads. Those are buzzwords. You have to master them so that when they give you the case, it becomes so easy for you. These are buzzwords. Buzzwords I'm using. This is a buzzword. This is also, this is also, this is also, this rash is also. You figure it out? Mommy is not telling you the full story. So while they were talking, the doctor's trying to figure out, was reading the EKG. Guess what happened? Mommy started reading the EKG slowly. No, the doctor was looking at the EKG, saw the ST elevation, saw the PR interval. All of a sudden, he saw the kid on the bed as like rapid, irregular involuntary buzzwords, okay, arm and legs, trunk, movement. And there's a flow from, it's like a flow, like you're doing breakdance, Kid was doing a breakdance on the bed. He's doing a breakdance on the bed, back and forth. That's what the doctor noticed. Breakdance on the bed. And the doctor said, oh, wait a minute. What is going on, mommy? You're not telling me the full story. And the doctor asks, is there anything I should know? Have I given you enough clues? Like the NCLEX will give you in the form of short case, 7-year-old in the PEDS clinic, rash on the body. They describe the rash, some joint pain, some fever, ESR and CRP elevated. Those are all inflammatory markers. EKG shows diffuse ST elevation in all leads, prolonged PR interval. And you have the kid moving like a snake, dancing, doing breakdance for you. What are you missing? What can you find? What does this tell you? Diffuse ST elevation, what does it tell you? What is prolonged PR interval tell you? Put it together. And finally, the mommy came clean. Okay, he came clean and said, oh, I remember something. Okay, I remember something. I don't know whether it's important. 3 weeks ago, he had a flu-like symptoms. And he was runny nose, So we do our traditional concoction, I give you like concoction, like we do all the time, regimen, basically. So I gave him some vitamin C, and I cooked some orange, and voila, he was fine 3 days. So that's what the mommy said. So 3 weeks ago, that's what happened. He had runny nose, so I gave him vitamin C. We cooked some orange, and then we let him drink it. That's what we do. Everybody do that, and they're back to life. And the kid was fine. And the doctor said, voila, why don't you tell me from the beginning? So the doctor went back and started examining the kid. So I'm trying to let you think so that when you're reading the case study, you won't be afraid. If they give you a long case, just keep on focusing on the buzzwords. You'll figure it out. It's like a puzzle. So the doctor went back, okay, and listened to the kid's heart. What did he, at the 5th intercostal space, you have to know this. These are all content, but in the case form, I'm trying to make it a joke, but I'm trying to let you guys think. 5th intercostal space at the left mid-clavicular. Line. So he had a murmur over there. There's a space. That space you should know. If you know the space, you know what kind of valve is involved. And with all these cases, you can put it together. 5th intercostal space. So if they give you a question, say, where would you listen to find out murmur in this kid? 5th intercostal space at the left clavicular, mid-clavicular line. That's where you go. And then when you look at the skin, you saw some subcutaneous nodules on it. The knees and the ankles are all swollen. It's a short case. This is a long, we'll be done back. I'm giving you everything that you need. Swollen knee. Now, You should by now figure out what this kid has. All the things I've given you is buzzword. I never label them like I give you acronyms for them. But if you look at it and say, oh, this is one of them, okay? This is another one of them. This is another one of them. And this movement, it has a name. And of course, this is your clue. So this is the problem. And so what is your diagnosis? And what are you going to do with this patient? I'm not telling you. So the problem is the problem. What is the problem? Diagnosis. What is the problem? This is a delay response to strep infection due to group A strep. So I call it exaggerated or excessive response to the strep antigen. So you get infection, you have the group A strep, okay? And then your body said, this is the antigen. Your body said, well, let me fight this. You have these T cells and the lymphocytes, the T and L cell made antibodies that attack this. So the antibodies basically come and attack these antigen. In the process of doing that, the bacteria trick them. It tricks the antibodies. It make an antigen that look like something on the skin, a protein, in your joint, in your brain, central nervous system, okay, your heart, basically. So it tricked the body and sometimes the bone. It tricked the body and it make the antigen that look like this organ. So when your body make the antibodies, you go and attack your home cells. So you go and attack them like that. So you attack these organs. So while you killing the bacteria, you're also destroying what? Your heart, okay, your skin, your joints, and sometimes your central nervous system are in trouble. This is the pathophysiology. It's because the bacteria are tricking your body system and you have exaggerated response to that antigen, and therefore all the organs in your body that is very important are in trouble. That's what happened to them. So that's what happened. Usually if you get this infection, I mean, you have sore throat, pharyngitis or flu-like symptoms. I think this is what triggered the overuse of antibiotic in the past, because everybody is afraid of this problem. So everybody decided to give people antibiotic for that. So you get sore throats, usually 3 to 7 days, it's gone, because you go to the emergency room and they do this rapid strep. And if it's positive, we give you antibiotic and you're done. 7 days, 7 to 10 days, you finish the antibiotics and you're done. But if you don't do that, and you do the concussion, you do the vitamin C, you don't do the strep throat, we can figure out what it is. We think it's a viral pharyngitis. Your body will fight it fine, but the antigen still remain. So untreated problem is an untreated response. Untreated strep infection is what causes the whole thing. And it happened, it stay behind, the antigen stay behind, waiting for the right moment. So after 2 weeks, minimum, after 2 weeks, usually 2 weeks to 6 weeks, that's when it strike. When it strike, it's no more called group A strep. It has a name. That's your job to figure out. And this name is what is causing the problem. So if there's no treatment, this is what happens. And this is what we're looking for when we examine you. When we examine you, we're looking for certain features, and we've divided it, not me, I'm not involved, but scientists have divided medicine folks into minor features. And these minor features is the one I show you. I give you a bunch of them. They're going to have fever. Okay, when you check a lab, their ESR and CRP will be elevated because it's inflammatory process, minor clinical features. They're going to have joint pain. We call it Arthralgia. These are all minor. And when you listen to their heart, or you get an EKG, you get a prolonged PR interval. Do you see some acronym here? I will show you. So FEAP. You can use the R as an acronym and put the R, the ESR or CRP, just use the R. You can make something out of it. So we're going to use the R. So you have an F here, you have R, you have A and P. So that's the first acronym. So this is what we ask. This is what we have. The first one, these are minor symptoms. Now, there's a major symptoms. The major symptoms are very important. The major symptoms are very important. They have joint problem. And these joint problem move from place to place, migratory. So that's why you see the ankles, the knees is in trouble. Then you have a heart problem. Okay, you have a heart problem, so cardiac. So I'll draw it like that. So this is cardiac. The cardiac is key. Your heart, the lining can get infected. The muscle can get infected. And the outside skin can get infected. Therefore, you can have endocarditis, that's the inside lining. Outside lining is pericarditis. And the muscle itself is the myocarditis. This is what the kid had with the diffused ST elevation. He has pericarditis associated with it. So diffused ST elevation is pericarditis. It's not myocardial infarction. So that's the other one. Then we saw the nodules on the skin. In the E, you saw the rash, right? Erythema, marginatum, right? So erythema, marginatum. That's the description we give. And the S is the snake-like movement, Sydenham chorea. And that is the Jones criteria. And this is the frap. So we're frapping Jones. So when you have to make a diagnosis, you need two majors or one major plus two minors. The kids has all of them to be able to make the diagnosis. So that's the problem. That's the key aspect of it. Now I want to give you some of the testable things they're going to ask you. So we figure out already. The lab work, I told you, they ask you the lab work, you get an ESR, CRP, and there's one more. The antigen that was causing the problem, you can test for it. It's called strep, streptolysin O. So we would, to be able to look for the antigen, we call it Antistreptolysin O titer. So this is what you look for, Antistreptolysin O titer. So if it's elevated, we know that the kid has rheumatic fever. That is very key. We want to prevent the complication, the major complication of this. Okay, we want to prevent it. If this is left untreated, if we don't do anything about it, the major problem is the heart. So we get the mitral valve of the heart will be sticky, stenosis. You get thicker and it starts regurgitating, like refluxing back. So you get a heart failure and pulmonary edema. Blood get back to the lung and they get into trouble. So this is what we want to prevent. If you don't treat this rheumatic fever, so this is the progression. You get a strep, you got to treat it. If you don't treat it, you get rheumatic fever. If you don't treat the rheumatic fever, you get the complication from it. I didn't want to give you the answer, but now I'll give you the answer. So, but that is the key aspect of it. We want to prevent this problem. Okay, now we are nurses, so let's do the nursing stuff. Then we'll be done. It's a short case, you know. Treatment, what do you do? This is key. People always confused. Some people will teach you different. This is very important. It's very confusing. A lot of people can make mistake. I can make a mistake about, but think about it. The kid has what, 2 weeks? He has an infection 3 weeks ago. What did he have? Strep A. What kind of precaution do you put him on strep A? What do you guys think? What is the isolation? Droplet. So somebody said droplet. Excellent. Droplet. But when they come in, this is just a strep infection. When they have rheumatic fever, acute rheumatic fever, what do you think? What kind of isolation precaution do you give them? When you have strep A infection, it's a droplet. When they come in with the acute rheumatic fever, is what? A lot of 95% of people will get this wrong. 95 will get this wrong. But if you listen to this lecture, you will never get it wrong anymore. What will you put this kid in rheumatic fever? If he come in with rheumatic fever, what is your precaution? What is your precaution when he come in again? Remember, when he come in with rheumatic fever, acute rheumatic fever, the kid has no signs of infection. He has no active. There's no active infection anymore. All you have is an immune response to the antigen, the strep antigen that has been walking around. So the precaution that the kid need, isolation precaution, is a standard precaution. If they give it to you, standard precaution. Don't do droplet, airborne. Droplet is wrong. Don't pick a droplet answer, please. It's a standard precaution. This kid is no more under anything. So provide standard precaution, wash your hands and all those things. Is acute rheumatic fever is not the same thing as having strep A infection. So it's a standard precaution. So put the patient on standard precaution. That's all. That's one is taken care of. Now we got to treat the problem. So you need antibiotic, which you should have get a long time ago. The common one is penicillin or amoxicillin. Before you give antibiotic, what do you need? You always have to check for what? What do you guys think? Every time you're going to give somebody antibiotic, The first question is what? What do you assess first? The allergic response, right? So check for allergy. Well, NCLEX can trap you and ask you, hey, the kid has penicillin allergy. So what are you going to do next? You have options. I want to give it everything to you in this review so that you can, if there is no penicillin there, you have to give them something else. Okay, give them something else. Okay, we don't need to culture this problem. We already know the kid has rheumatic, so there's no culture. It's not going to. We already done the rapid response. The most important thing when you're giving somebody antibiotic, you got to check the allergy. Penicillin, if they are allergic to penicillin, you have other options. Okay, I don't think NCLEX will confuse you with that. I will list them, but I'll tell you which one you should pension and pay attention to. There is, penicillin is a cephalosporin. And the idea teaching, you'll find it in YouTube. They'll tell you if somebody is allergic to penicillin, you should not give them cephalosporin. This is medicine, clinical medicine. So I'm telling you, but if you see that, I'll tell you which answer you should choose. Cephalosporin. There is a narrow spectrum cephalosporin that you can give it to people who are allergic to penicillin. And those ones, cefalazine is fine. Okay, this medication is fine. Or cefadroxil. This one, narrow spectrum, you can still give it to them. So we give these patients who have rheumatic fever, allergic to penicillin, this penicillin derivative, but they have narrow spectrum, so they will take it without any problem. If you see this in your answer choice, don't pick it because there's another option. Unless all of them are cephalosporin, then you can pick this two. If all of them are cephalosporin, you can pick one of them. These two is okay. You cannot pick any other cephalosporin if they're allergic to penicillin. But the rest is easy. You can use clindamycin, okay? Or azithromycin, Z-Pack, that's what you hear about. Or clarithromycin. This medication can be used when you're allergic to penicillin, those three. So in answer choice, if I have all this, I'll pick one of those if the patient is allergic to penicillin, just to clarify that. Okay, these are also good, but I think they're not going to confuse you because cephalosporin, you've been taught not to give cephalosporin to somebody who have penicillin allergy. I'm saying that those are narrow spectrum. They are acceptable answers, but this one are better. In order to make the exams fair, I think they will give you this instead of cephalosporin. So you need to give the kid antibiotic. The key is long-term antibiotic. They need to know that it's a long-term antibiotic. When they have acute pharyngitis, it's just the 7 days, 7 to 10 days. This is long. They have to come in monthly and they get injection. It can take 6 months trying to get this taken care of. So it's very, very important that they know that they need a long-term antibiotic. And this is the compliance is the problem. So you're teaching, you teach them about compliance. And then you tell them, if you're going to have any dental problem, yeah, you need antibiotic. That's key. And the other thing too is when you get the strep, you are not immune, That's key. You are not immune to the condition. You will need to let me know every time you have strep infection, because your risk of acute rheumatic fever is more than 2 times than the general population. So you are not immune. You can get recurrent disease. Because of that, I want you to finish the antibiotic therapy. That's the teaching moment. Okay, so that is very, very important. Now, let's go back to our nursing staff. The kid is doing breakdance, the chorea, right? What is the most important thing about this as a nurse? What you worry about? What are you worried about? By the kid dancing. You should be worried about something. And it's your number one job as a nurse is to ensure safety. So safety is your number one. And this kid will fall. So you got to make sure fall risks is prevented as much as possible. The chorea does not let them move. They move so they get tired, they can't do. So it's good to encourage them, take some rest, but I want you to move in bed. You can still move in bed and do some exercise. So like their joint will be all swollen, so you can do it like passive range of motion and to help with their legs. So you can do passive range of motion to help with that. It's very, very important, especially with the arthritis. Now, what other things do you think you need based on the condition? Who are you going to call to come and help you? Who are you going to call? There's some specialty that you can call, right? The kid has an arthritis, okay? And he has cardiac problem. So you need cardiology, right? Cardiology to monitor them. And arthritis, you can just do range of motion, and you can use ice, and then warm pads. Why? Heat pads. Why can you use ice and warm pads in these people? What do you guys think? You got to know what each of them is going to do. Ice is going to do something different, and the warm is going to do, heat pad is going to do something different. Remember, the knees and the joint is all swollen and the other thing. So you can apply both ice and cold and ice and warm stuff to cold pad to help with that. So the warm, that means the hot pads is going to help with loose the joint and make the joint flexible, and the cold ice pack will decrease inflammation. So you can use both to help with the situation. Okay, so those are the key, those are your management. You got to make sure the kid come in and do follow-up echocardiogram to check their heart and ensure that they're doing well. Otherwise, they get into trouble. A long term of antibiotic, and that is your treatment. It's rheumatic fever, flap joints. It's straightforward. When they give you, they can't hide it because they're going to give you those major symptoms and the minor symptoms. And you should not confuse it with Antithin disease, because Antithin disease does not have those feverish, no sore throat, nothing like that. There's genetic implication to that. You cannot confuse this with Kawasaki disease, because with Kawasaki disease, you need to have fever for what? 5 days, greater than 5 days. And the symptoms are thick cramps. Of course, they all have cardiac problem, skin lesion, but the rash are different. The rash, I described the rash for you, and their temperature. Kawasaki temperature is very high, 105, 104. Okay, strawberry tongue. Both of them can have strawberry tongue, but the key is one dance like a snake, the other one does not dance. And you cannot confuse this with what? Scarlet fever, because scarlet fever, even though it's also as pharyngitis, what? They have sandpaper rash. So you'll be able to see that. Those are the keys you should focus on when they give you this kind of question. These three, you have to master it. I have a video on my channel. You should watch it. I compare all the three of them just for your sake, in case they give you that kind of question. That is the only way they can trap you, because all of them are kids. So don't forget frapping of your joints, okay? When you frap your joints, it's different from you are T-cramming, okay? And when you are not thin creaming, you will probably use sandpaper in your shoes, and that's scarlet fever. So they are all different diseases. This is our Dr. NCLEX. Thank you for watching. If you need more help, the subscriber button there, you can put on it, press on it, and then you can like this video and share it to your friends. But thank you. You have a good night. Any question before I sign off? No question. Thank you very much.